Hi, my name is Rachel Sage McCafferty, and today I'm going to be demonstrating how to properly hang and prime IV fluids. The very first thing that I will do is check my orders. Then I will go to the Pyxis to gather my supplies. Whenever I'm gathering the medications, I am checking them against the original order and against the MAR. I'm checking for any expiration dates. I'm assessing if the client has any allergies to the medications. I'm also going to be doing any dosage calculations that are necessary. And then with the medications, I'm also noting the normal dose and frequency and any contraindications that the patient may have to the medication, any nursing considerations, any assessment data that might need to be completed, any adverse effects, and the normal onset and peak of the medications as well. Then I will wash my hands before touching anything in the Pyxis. I will gather these supplies and go into the patient's room. Upon entering, I'm going to pull the curtain closed. I'm going to introduce myself, and I'm going to ID the patient by asking their name and date of birth and checking it on their wristband. Also, before administering the medication, I'm going to scan the medication and scan the wristband just for a final check to make sure that I have the right patient and the right medicine. I also want to be doing this at the right time. But after IDing the patient, I'm going to explain the procedure, let them know what I'm doing and what medications I'm giving them and any information that they might need to know about the medication. Then I will raise the bed to an appropriate height. I will apply PPE. Then I will assess the IV site and make sure that the dressing is clean, dry, and intact, and that there's no redness or bruising or inflammation around that IV site. Next, I will determine the patency of the IV site by taking a normal saline syringe and an alcohol-based wipe, removing the syringe from its packaging, pushing out any air bubbles that there may be. I'm going to remove the alcohol wipe. Going to sterilize for 15 seconds the hub, which I'm going to then insert the normal saline syringe into the hub. I'm going to unclamp it, and I'm going to flush for long enough to determine that the IV site is patent. Then I will reclamp and remove the normal saline. Next, I will get my primary bag, remove it from the packaging, I will then remove primary tubing from the bag. Okay, I'm going to immediately clamp the tubing. Then I will remove the cap on the spike. And then I will push the spike into the bag. By pushing and twisting until the filter is covered. Then I will squeeze that drip chamber until it's about half full. And then I'll just hang this on the side here, making sure that none of my tubing ever touches the ground. Next, I will take my secondary bag out of the packaging. I am making sure that I'm working on a sterile surface here. Taking secondary tubing out of the bag. This is the hanger that I'm going to use to make sure that it's hanging higher than the primary bag. First thing I'm going to do is clamp the tubing. By rolling this down. Okay, tube is clamped. Then I'll remove the spike. By pushing and twisting till that filter is covered. Okay, and I'm going to flip it over, squeeze the drip chamber until it's about half full. Okay. Gonna hang that secondary bag to the side now. I could have done this before spiking the secondary fluid, but next I'm going to prime this tubing. Okay, so I'm going to do this by unclamping. Allowing that fluid to flow through. So looking for air bubbles, making sure that there aren't any air bubbles in here. Okay, now that that is primed, I will hang it back up and prime the secondary bag. Also, I would reclamp that bag, the primary bag. And then now that I'm priming the secondary fluid, I'm going to unclamp. And it's very important with secondary medications that you release the clamp slowly as to not waste any medicine. So and then I would reclamp. And then I want to make sure that the secondary bag is hanging higher I want to make sure that the secondary tubing is hanging higher than the primary tubing. And then I'm going to attach the secondary tubing to the primary bag in the port that is closest to the primary bag. So the secondary bag is getting attached to the primary tubing. it will be hanging higher than the primary bag, and it will attach to the primary tubing in the port that is closest to the bag. And I will do that now. Okay. So the secondary bag hanging higher than the primary bag. Okay. When I was doing the initial flush, I would have made sure that there wasn't any pain or coldness or tenderness above the area of the IV site. Once I'm completely done hanging the medications, I'm going to return the bed to its lowest position. I will assess for additional client needs. Then I will dispose of my PPE properly. I will clean any equipment that touched the patient. I will wash my hands again, and then lastly, I will document.